Is sugar a poison to the body?
India is called as the diabetic capital of the world.
Oh yes. Does diabetes affect the brain?
Yes. Sleep is really very important.
I am being a neurosurgeon. I have been doing a lot of research on lymphatic system of the brain. This is a very basic question which always comes to my mind. Brain utilizes only glucose for survival.
Yes.
Brain does not need
Only
anything
fuel,
else.
yeah.
So this kind of high spikes and high dips, does brain tolerate it?
If they don't come on time, if the medication or management is not started on time or not properly treated, they can succumb also. But it can also cause permanent damage to the brain, irreversible hypoglycemia.
Right. What is abdominal obesity?
So abdominal obesity is the abdominal girth, the waist circumference.
Okay. About 5 patients were admitted in the ICU with the brain hemorrhage, and the youngest one was 23-year-old girl, and the oldest was about 34-year-old male, and all 5 had hypertension, and which was detected after admission. I am Dr. Ashok Hande. I am a neurosurgeon practicing in New Bombay since 1996. I specialize in a surgery for brain stroke. Yeah, hi Farah. Please come in.
Thank you so much.
This is our little studio where we do the recording of the podcast. So, good morning, Farah.
Good morning.
Welcome to our channel. This channel is dedicated to preventing brain strokes. So, we have been inviting the leading physicians at Navi Mumbai who have been dealing with the brain stroke and the risk factors which are causing the brain stroke. So, today we'll be discussing about hypertension and diabetes, which are the most common risk factors for the brain stroke. But let me introduce yourself to my viewers. Dr. Mrs. Farah Ingle is a senior consultant and physician and diabetologist. She also is an intensivist. Right now, she's practicing in Fortis Hospital, Hiranandani, New Bombay. She has an experience over 35 years of practice. Initially, after working in PD Hinduja Hospital, Mumbai in 92 for 7 years. How many years? 7 years. She has an experience in working in Hinduja. Then also she was head of the Department of Medicine in Navi Mumbai Municipal Corporation Hospital. What is impressive about Farah is that she is the first president of Lady Physician Association of Navi Mumbai, and she stood first in FMT, and she got Dr. Dhananjay Paritoshik Award for that. Yes, and she also is a Silver Jubilee Memorial Prize, standing for first in family planning. And what is FMD stands for?
FMT is Forensic Medicine and Toxicology.
Toxicology.
That was in the 2nd year.
Okay.
And I was in the merit in the 3rd year also in the university in 3rd MBBS.
Right.
So that Silver Jubilee Prize is for standing in the merit in 3rd MBBS.
Oh, that's right. Thank you for correcting me. And she also has a merit in 3rd MBBS, standing 4th in the university. Yes. And she received certificate of Best Doctors Award from New Bombay Municipal Corporation. And she has published many papers at national and international level. Most important thing, what I would like to say about Dr. Farah Ingle, that she has done world first study on role of parental omega-3 fatty acid as an immunomodulator in renal failure with sepsis, and that is really creditable. And second subject that she has worked on, the effect of tobacco chewing on kidney functions and metabolism. She has been guest speakers at multiple conferences, as I said before, in domestic and international conferences, and also here in Navi Mumbai. Now, Farah, we have a tradition of starting the podcast with a quick fire round questions. And during this quick fire round questions, you are supposed to answer only yes or no. I mean, there is nothing like phone a friend or 50-50 options that Amitabh Bachchan asked on KBC. Yes. So either you answer that in yes or no, or at the most one sentence answer is allowed for you. Okay. So there goes the question.
Thank you for inviting me here today. It's actually a privilege and pleasure to be here and at least contributing to whatever extent to your noble work which you're doing. So
thank you so much, Farah. So let's start with a quick fire question now. Sure. No. 1, does blood sugar variation matter for the brain health?
Yes.
Is sugar a poison to the body?
Not exactly.
Not exactly.
We cannot say exactly as a poison, but it matters.
It does
It,
matter.
it causes deleterious effects
Okay.
on the body.
What is the biggest misconception surrounding blood sugar?
People think it's only because of eating excess sugar that you get diabetes. It's not so.
That's a
Exactly.
misconception.
It's a misconception.
Okay. What is better, processed sugar or good?
Processed sugar is actually not good at all. To some extent, good is little better, but both are not good finally.
Both are not. Even good is
Yeah.
not good.
It's not good for diabetes.
Okay.
Yeah.
All right.
Yeah.
Okay. Does diabetes affect the brain?
Yes, it does affect
It
the
does
brain.
affect the brain.
Yes.
Does diabetes affect the kidneys?
Yes, it does.
Does diabetes affect the heart?
Yes, of course.
Does diabetes affect my productivity?
Of course.
Okay. Are you seeing more and more patients with pediatric population now with diabetes?
Yes, these days we are seeing more younger people coming with diabetes.
Okay.
Yeah.
Does family history of diabetes matter?
Of course, it matters.
Oh. So, what I get an impression, Farah, from this quick fire round, that diabetes seems to be a disease which affects the entire body.
Yes.
It
from
is
head.
no more a disease which is affecting only the brain or the heart or the kidney.
Right.
It affects the entire body.
Yes.
So, if that is so when I asked you about is sugar a poison, why did you say that it is not necessarily?
Sugar, when taken in excess, can be compared to being a poison for a body,
Okay.
but not always a poison. If you are in your limits, if you are doing anything moderately, then you may not say that it's a poison.
Okay.
But taking anything in excess, so also for sugar, will be
Yeah.
deleterious. It will have detrimental effect on the body,
Yeah.
and then it can be taken as a poison. So
Right.
it's not always that it's a poison.
Okay. So if I ask you that it is not exactly a poison, but it could be if we take in excess.
Excess.
So what is the definition of the excess of sugar?
See, now normally what happens is sugar means it is carbohydrate
Right.
with a high glycemic index. So anything with high glycemic index can cause your blood sugar levels to go up.
Right.
And it varies from person to person. If you're already a diabetic or a pre-diabetic, then sugar is an absolute no-no for you.
Right.
But if you're not a diabetic or pre-diabetic, carbohydrates are still required for us for instant energy. And we in India, we are more of carbohydrate eaters.
Right.
We take excess of carbohydrate.
Yes.
Then in that case, because there is problem with insulin when you are diabetic. If you are type 1 diabetic, there is no insulin. It's an autoimmune disease where there's lack of insulin in the body.
Right.
That is why those people require insulin to be given from outside
Right.
to treat sugars, high blood sugar levels. And if you are type 2 diabetic, there is reduced insulin secretion, increased insulin resistance. So that is why the sugars which you're taking from the food is not neutralized by the insulin inside your body, and that is how the blood sugar level goes up. So you have to be in moderation, and if you're a diabetic, it is better to avoid it completely.
Completely. So what I understand from the discussion, insulin is a hormone which is produced by the pancreas in the body,
Yeah,
and that is the one which keeps the blood sugar level in check.
regulates it.
So if I eat more sugar, the insulin secretion goes up.
Yeah,
Normal people.
Yeah.
And if I eat less sugar, the insulin secretion also goes up, goes down.
yeah,
So it's a kind of a negative feedback mechanism this body works on.
correct.
And you said in type 1 diabetes there is absence of insulin at all.
Insulin inside
And that's the
it.
reason that we have to give from
Insulin
external
from
sources.
outside.
Am I right?
Correct.
Okay.
Because type 1 diabetics cannot be treated by oral hypoglycemics.
Okay.
You have to give them insulin to
Understand.
keep sugars under
Okay.
control.
Now, when you check the blood for the blood sugar, what kind of sugar levels are checked inside the blood?
If you're a known diabetic, then you check fasting and
Yes.
post-lunch blood sugars, that is postprandial.
Okay.
And then HbA1c is glycosylated hemoglobin,
Okay.
which is a 3 months average of your sugar control.
3
So-
months average.
Yeah, that we check once in 3 months.
Okay.
Not necessarily 3 months, because the lifespan of RBC is 3 months.
Right.
So it is 120 days because that is in the RBC.
Right.
So normally we check it once in 3 months, and fasting and postprandial. Because suppose last month if you take, your sugars were high. So HbA1c this month also, if you check, may come high if it is the same RBC which is regulating in
Right.
the circulation.
Right.
So you should also check fasting and post-lunch to know exactly what your present sugars are. And
Right.
also HbA1c can get, it varies in various conditions, in hemoglobinopathies, if you're anemic, so
Right.
it may not be right. So
Okay.
fasting PP also we do.
We should do.
We should
Yeah.
do. Yes.
So you're telling me that life of RBC goes on for 3 months, and that's the reason since this HB1AC is situated inside the
Inside the
RBC, you
RBC.
can repeat it every 3 months.
Yes.
So
we check
is
every
this
3 months.
HB1AC that you're talking of, the levels of which are used for the monitoring purpose?
Yes, to know the control of sugars,
Control the
average
sugar.
control of sugars for
Yes.
last 3 months.
Yes, of last 3 months.
Last 3 months.
And then you keep changing the dosage of the medicine as per
Accordingly.
the report, right?
As per A1C and fasting and postprandial.
What is the normal level for blood sugar
See, if you are non-diabetic,
in normal people,
in
non-diabetic?
normal people, non-diabetic, HbA1c should be less than 5.7 to
Okay.
be labeled as non-diabetic.
Right,
And fasting sugar less than 99 and post-lunch sugar less than 140.
140.
Then we have this entity called pre-diabetes.
Okay,
In pre-diabetes, HbA1c is between 5.7 to 6.4.
right,
With fasting sugar, you can say up to 99 to 110, 120 or
Okay.
126
Okay.
in pre-diabetes.
okay,
And post-lunch more than 140.
okay,
And like in diabetes, then HbA1c is more than 6.5. And
okay,
if you do fasting sugar, it is definitely more than 110. Then 2 hours, that is postprandial sugar,
Okay.
or after oral glucose tolerance test with
Right.
75 grams of glucose
Okay.
when it comes to more than 200.
okay,
So fasting more than 126 and postprandial or after OGTT more than 200
Oh, right.
is labeled as diabetic.
Right.
And A1C more than
yeah.
6.5.
So this test that you're talking of, the oral glucose tolerance test, which are the patients where you would like to do such tests?
We do such tests to detect for detection of diabetes
Right.
in those patients who are at high risk of developing diabetes.
Mhm.
One is as a screening test, we do that. Nowadays, because the incidence of diabetes is already high in our country, India is called as the diabetic capital of the world.
Oh yes.
Yeah, and we have large number of diabetic patients. So we do that as a screening test for detection of diabetes. Then in those people especially who have a family history of diabetes,
Okay.
who are obese,
Right.
who lives a sedentary lifestyle,
mhm,
all those who are prone for developing diabetes, those who are under stress, having repeated infections, maybe they are diabetic. So in those people, we do that test to diagnose diabetes, and then accordingly we manage
Yeah.
further.
But if you find that HB1AC is on the higher side, or if somebody has a family history of diabetes, he's obese, he's working under stress,
Yeah.
so you do this glucose tolerance test in every such cases?
Or you can do 2 hours postprandial with A1C,
Okay.
HbA1c.
Okay. Parameters basically used to monitor how you are responding to the treatment.
Yes.
There's a basic function of that.
Yes.
Oh, that's nice. So now the people who are say 60 plus and they do not have a family history of diabetes, and but my sugars are slightly on the high side, both fasting and postprandial. So in such people, what will you advise? Because I don't have any other things which will support me as a diabetic guy, but my sugar, say fasting sugar is 110, or my postprandial sugar is 160,
Yeah.
and my HB1AC is normal, suppose, or maybe a higher limit of the normal range.
Yeah.
So what kind of advice would like to give it to me?
Yeah, so like family history is just one part of it.
Right.
There are other reasons for developing type 2 diabetes.
Right.
Like you said, person is in stress,
Right.
leading a sedentary lifestyle, is obese, which are all risk factors for development of type 2 diabetes.
Correct.
Such people, and he's elderly, more than 60. So such people needs to be monitored more often. You have to keep on checking them at intervals. But then along with that, what is more important to begin with is lifestyle modification.
That's right.
Yeah, so he has to be advised about proper diet, better to avoid sweets, sugar, jaggery, honey, everything,
Right.
fast food, fried food, all those things which comes as, which is labeled as a diabetic diet.
Diabetic diet.
Yeah, so you have to follow a proper diabetic diet, which is otherwise also healthy, even if you're not diabetic. Then about physical activity.
Right.
So doing maybe just 30 minutes of physical activity, maybe
Right.
moderate intensity every day, or at least 5 days in a week, which comes to 150 minutes of physical
Right.
activity in a week of moderate intensity that we advise to our patients, and also not taking stress, because stress also can precipitate sugar levels and blood
Correct.
pressure, and also sleep. Sleep is very important because total health is actually physical, mental, and spiritual health.
Right.
We only concentrate on our
Physical health.
but sleep is really very important, and we hardly take that into consideration, which should be actually taken seriously.
Right.
So we should advise our patients to have proper, uninterrupted, peaceful sleep during night, at least 7 to 8 hours of proper, peaceful,
Right.
uninterrupted sleep.
Right.
It should not be less than 6 hours. It should not be more than 9 hours.
Yeah,
Both
correct.
ways also not good.
Yeah.
So like basically they have to modify their
Yeah.
lifestyle.
So such people that you said who are coming under this high risk group category, but they are not diabetic. So how frequently do you advise them to repeat blood sugar? Once in 3 months or something like that?
If they are not diabetic,
Yes.
if they are not elderly,
Right.
if there is no family history of diabetes
Yes.
or no other risk factors, then once in a year.
Once in a year.
Once in a year. But if they are borderline diabetics or they have risk factors, then
Okay.
we check more often.
More often.
Depending on whether once in 3 months
Okay.
or 6 months,
Okay.
depending on the comorbidities.
I am being a neurosurgeon. I have been doing a lot of research on the lymphatic system of the brain. Now we have lymphatic system in the rest of the body, but brain is a unique organ which has got a lymphatic system. So whatever high molecular weight byproducts are produced after the metabolism in the brain, there are no lymphatics like in the brain. So there is a system inside the brain which will drain this kind of a high molecular weight byproduct or toxic product and ultimately drain into the venous sinuses. And that's how that lymphatic system of the brain, which is completely separate from the rest of the body, enters into the venous channel and it by to the heart.
Correct.
Because the rest of the body drains lymph through the thoracic duct. So brain does not have the thoracic duct. So what they have discovered, the people, and this system of lymphatics works only during the night time. It doesn't work in the day. In the daytime, this system is completely silent.
Yes.
So it works only during the night time.
Yeah.
And if you don't have a good night's sleep,
Yes.
this particular system doesn't function properly. And that is one of the mechanisms what people have been talking about, the brain fog,
Correct.
or the memory lapses,
Correct.
dementia and Alzheimer's.
Yes.
So that's a very good topic which requires a separate discussion
Correct.
altogether.
Lengthy.
But I am very happy that you really brought it out.
Yeah, that's why I said night sleep.
Night sleep is
Yeah,
most
very
important.
important.
Very, very
Yeah,
important.
very
At least 7 to 8 hours of sleep.
7 to 8
undisturbed
hours.
sleep.
Undisturbed,
Yeah.
peaceful.
But now you are being a physician for so many years. I'm sure you must be getting the calls from the hospital in the night time also.
Yes.
How frequently can you afford to have undisturbed 7 to 8 hours of sleep?
In our profession, it's really difficult.
It's really difficult. Yeah.
The moment you go home, the call starts.
So we are here just to advise people, but we ourselves
Ourselves
cannot
don't-
follow the
yeah,
principle that we are talking
yeah,
of.
it's difficult
That's a
for
sad
us,
part of
yeah.
the profession,
Sad
I
part of our
suppose.
profession,
Yeah,
that's what, true,
I mean
very
we are
true.
paying the price for it.
Yeah, we advise our patients to eat a healthy diet, eating on time, regular physical and proper sleep.
So yeah, looking at us, we don't eat in times. Many times we don't eat at all. We don't know what is happening to our blood sugar.
right.
We sleep late. Yeah, we don't take 7 to 8 hours of sleep.
Yeah.
So good. I
And
think
stress
we are
also
all
is
in
there for
the
our
same
profession
boat.
as such.
Yeah.
Any serious patient coming in, relatives keep their
Yeah.
so everything. No, it's always disturbing.
Right.
But then that's our profession. We are
Right.
into it by choice.
Correct, you are in charge. Nobody forced us, obviously.
That's what. Yeah.
One thing, since we have been working on this brain stroke since past so many years, this is a very basic question which always comes to my mind. Brain utilizes only glucose for survival.
yes.
Brain does not
That's
need
only
anything
fuel,
else.
yeah.
Yeah. Now, when I eat the diet which is very rich in sugar or carbohydrates, my blood sugar tend to spike up.
Yes.
Or say, if I'm fasting, like you are fasting, today, the sugar might just dip down.
Me.
So this kind of high spikes and high dips, does brain tolerate it?
Yeah, that these spikes, whether it is too high or too low, is also not good for the brain.
Okay.
Most of the time it accommodates, but not every time. Like
Okay.
suddenly if the sugars goes to more than 300, if it spikes
Right.
to more than
Right.
300, it can affect your brain function,
Right.
your cognitive function, and then you may even land up in a stroke
Right.
because of that. Sudden fluctuations in the
Yeah,
sugars
yeah,
are not
yeah.
good. So also hypo is not good.
Okay.
As you rightly said, brain utilizes only glucose. That's the
Right.
only fuel which brain lives on. And if sugars goes low, it can affect your brain within 3 minutes, depending on how much low the sugar is gone,
Right.
and it is going to affect the brain function.
Yeah, brain function.
Yes.
So what happens to people, who fast for a very long time? Sometimes, they are on some kind of a fasting for a cause.
Yes.
So when they don't drink at all for days together, what happens to them after 4 or 5 days? Does the brain function normally, or they get confused?
About the sugars you're talking
Yes,
about.
yes.
Yeah. So fasting also, if you're doing long fasting, like intermittent fasting is the fad these days, it's not good for everyone. So you have to be the right candidate to fit into that first of all.
Okay.
If you are diabetic, if you have other comorbidities, you're too frail, you cannot do that long fast. And even if you're planning to go into that fast mode, you have to actually train your body. So don't start immediately with 16 or 18 hours or 20 hours fast.
Okay.
You can start with 8 hours, go to 10 hours, 12 hours. Your body has to get tuned to it. Adapt
Gradually
it,
go on
gradually
increasing.
go on increasing, and monitor yourself.
Right.
And then like suppose, like of course for instant energy we need carbohydrate, glucose. But then later on, then the body utilizes lipids and proteins for energy.
Right.
Because glucose is exhausted.
Right.
And it will release glucose from other systems of our body.
Okay.
So that is how it takes care of itself.
Mhm,
But if you're not a candidate, you should not fast.
Okay.
That is what I would advise.
So, what kind of advice you will give to the diabetic people who are on medication to control the blood sugar during these festivities? When they fast for a long time. So, what advice will you give to them?
Yeah. See, it is not that the diabetics cannot fast. Diabetics can fast with precautions.
Okay.
So they have to actually, they have to eat food which is a low glycemic index food.
Okay.
So that immediately it will not release instant energy. It will be over a period of time
Right.
that the sugar is and the instant energy is not there. It will be over a period of time that the energy is released and that is taken care of. Then we have to adjust the medications. You have to adjust the timing of the food. You have to adjust the quantity of the food. You have to even adjust the medication. Now,
Okay.
some medicines can cause more hypoglycemias, and if you don't eat, then the sugars do not get neutralized, or sugars goes low. If you eat too much, sugars will not get neutralized. If you don't eat, sugars will go low. So you have to put them on the right medicine. You have to train them how to go about and they have to eat the right kind of food, and they can still monitor the sugars even if you're fasting. You can monitor the sugars.
Okay.
And if you feel, because everyone do not get all the symptoms and signs of hypoglycemia,
Right.
which is called as
Right.
hypoglycemic unawareness. So you
Okay.
better monitor yourself.
Mhm,
And if that is there, then you break the fast, you eat something.
Right.
Now, normally in our country, we have lots of feasts. And for diabetes, actually speaking, there should be no feasting, no fasting.
Yes,
you
that's
are-
what I was wondering.
Yeah.
Yes.
So if you are on insulin, especially, if you are not that severely diabetic, you can still fast. But
Okay.
if you are requiring large doses of medication, you're on insulin, you're not able to eat properly, if you have comorbidities, if you're frail, you're too aged, then we advise not to fast and not to
Okay.
feast also. So now we normally have lots of festivals where
Right.
they indulge in sweets, they
Yes.
indulge in fatty foods, fried foods, fast foods. That's also not right.
Yeah, I was going to
So,
come to that because our
yeah.
country is so much full of festivities. All the
Festivities,
time,
all-
round the clock,
Yeah,
there are festivities.
throughout the year.
I'm sure it was a hell of a job to manage diabetic people.
Yes, it keeps fluctuating. So every time, like after Diwali, patients come to
Yeah,
us and says,
yeah.
once in a year it is. So we indulged, and
Yeah.
then the sugars goes up. Then
Yeah.
it becomes difficult. Then
Yeah.
again we have to explain them everything,
Right.
and we have to guide them again how to go about. Keep
Right.
monitoring them.
Right.
Some of them understand. Who understands, they have their sugars in place even if it's the festival time.
Right.
But those who don't, suddenly sugars goes up, and then they can sometimes catch up infections or other problems they come with. So
Yeah.
it's
Do you have
really
more
hard.
admissions in the ICUs during these festivities?
Festival time, sometimes we do get admissions, and that is especially with type 1 diabetics, where
Okay.
they go into diabetic ketoacidosis
Right.
and they are on insulin.
Right.
Suddenly sugar shooting up, they go into diabetic ketoacidosis because of infections, because of dehydrations. Sometimes overeating, indulging yourself too much can cause loose motions,
Yeah.
gastritis, vomiting, they
Yeah.
become dehydrated. In that case, we need to admit.
Yeah.
At such times, admissions, yes, do go up. And type 2 diabetics, it is HHS, that is hyperosmolar hyperglycemic coma,
Right.
where ketones may not be there, but the sugars goes to more than 600. So
Right.
again, we have to admit them
Right.
and start them on insulin drips
Yeah.
and maintain good hydration and
Yeah.
keep monitoring.
So, what do you mean exactly by ketones and ketoacidosis?
It's a
What
serious
are they?
complication. It's a serious complication mostly of type 1 diabetes, where ketones gets excreted in the urine because of high blood sugar levels.
Okay.
And this is a serious condition because of dehydration, because of infection. This diabetic ketoacidosis happens mostly in type 1 diabetes,
Yeah.
and becomes a serious thing. It can affect
Yeah.
any system of your body. When you are dehydrated, your lactate levels goes up,
Right.
and your brain also can get affected in that case, and you can catch up other infections that
Yeah.
time because of high sugar.
But what are these ketones? Where do they come from?
They are all they get passed through urine and even in the blood.
Okay. So normally they are the
Basically,
byproducts of
byproducts
metabolism,
of
and they get excreted through the
they
urine.
excreted through the urine, and even
Yeah.
we check the blood ketones also.
Okay.
Both ways we do.
So this happens in normal people.
In
The
diabetic
ketones
people,
are produced and they are excreted
no,
through the urine.
ketones can be present in people who are diabetic, especially type 1 diabetes,
Right.
and also those who are starving.
Okay.
In that cases also, these byproducts are released through
Right.
urine or in the blood levels. The ketone levels goes up in the blood. So that is called as starvation ketosis.
Okay.
Even if they are not diabetic, that
Right.
can happen.
Okay.
But normally we see that in diabetics, and that too in type 1 diabetics.
Okay.
So it's a byproduct, as you rightly
It's a byproduct.
said. Yes.
So it's a
And it
serious
is in the-
condition,
It's a serious
ketoacidosis.
condition. It's a medical emergency.
Okay. It's an emergency.
Yes, it's an
Okay.
emergency.
Okay.
Because you need to admit them, you need to hydrate them well, you have to push in lots of fluids so that the lactates comes down, because lactates also goes up in that case, and of course start them on insulin drip
Yeah.
and all, and keep monitoring every
Yeah,
hour.
yeah. How well do they do after treatment, or the
They-
prognosis is bad in such people?
If they don't come on time, if the medication or management is not started on time or not properly treated, they can succumb also. But if they reach you on time and if you start proper medicine, they come out. So many people come out. Like if it depends on how you manage. It's not that it's 100% mortality with that.
Yeah.
They come out. They do very well.
So
And-
it's a what I'm getting the impression that it's a hell of a job. And during festivities when others are enjoying and you are
Yeah.
attending to the admission in the ICU.
Yeah.
I mean, and if they come with the ketoacidosis, since it's a life-threatening condition,
Life-threatening
right?
condition.
Oh,
Yes.
that's too bad with the
It's too
diabetes.
bad. For the-
If I give you choice of having either hypertension or diabetes, what will you choose?
Both are not good actually.
No, I know that. Of course, both are not good. But suppose, I mean, there is a choice available. I mean, if somebody tells me that you pick up one of
It's
those.
difficult for me to say that actually, because hypertension is also called as a silent
Yeah.
killer. Because
Yeah.
most of the times hypertensives do not have typical symptoms and signs,
Right.
and many a times they don't get detected
Yeah.
on time.
Yeah, yeah.
So it's difficult.
We
both
will
is
come to
not
that.
good.
But when I heard about this diabetes and the complication, looks like it's a deadly disease, you know.
Yeah, it's
The-
because yes, diabetes is one such problem which can affect you from head to toe. It's a metabolic disease,
Right.
and it's a chronic inflammatory condition.
Right.
So it is definitely, if it is not kept under control, it can affect any system of your body
Right.
and can take you anywhere. Actually,
Right, right.
It's not good otherwise. Yeah.
So, tell me one thing. If diabetes is a metabolic disease which affects the entire body simultaneously, so suppose somebody has bad kidneys because of diabetes.
Yeah.
So that doesn't mean your heart and brain are normal. They also must be getting affected to
Yes,
some extent.
Yes, yes.
Right?
Heart and brain also gets
Correct.
affected because of
So
diabetes.
you must have seen some patients admitted under your care who have got, say, renal failure, for example. After 2 days, while they are in ICU getting treated by you, They also must be developing brain infarcts or cardiac problems
Yes,
there.
they do develop.
Yeah.
It's all
Yeah.
documented, very well
Is
documented.
documented.
Cardiac problems can happen because
Yes,
of
yes.
diabetes, brain problems,
Yeah.
strokes can happen because
Yeah.
of diabetes.
So this is something like buy one get one free, right? So I mean, you get admitted with a kidney problem, but also
Yeah.
land up having
Correct.
heart of the problem related to the
Yes,
brain. Yeah,
true, true.
that is the diabetes. Oh my
That's
God.
what, yeah.
We spoke about spikes in the blood sugar. We spoke about how the spikes can affect the entire body, mainly the brain or heart. Now, do you think that they also affect the hormones inside the body? Say like menopause, or
Yes.
I mean, is it related very closely to such people, those who are about to get menopause or during perimenopausal period, or
Yes.
polycystic ovarian disease?
Yes.
I mean, do they affect?
Yes, yes.
Yeah.
At all stages of women's life,
Hmm.
whether it's a young woman in the reproductive age group, or
Hmm.
perimenopausal, menopausal, or even an elderly postmenopausal lady. So, as you rightly said, a young lady, then who may have PCOS, PCOD,
Right.
they have these hormonal fluctuations in
Correct.
them. So these people also, they don't do that good if the things are not kept under control. And even those young ladies who are on OCPs,
Right.
so that also can
Right.
cause a problem.
Okay.
And then in the perimenopausal, menopausal period, now when they attain menopause, estrogen is gone.
Right.
So that's actually called as a suraksha kavach for a lady.
Right.
And then you become equal to men in many cases, because as long as estrogen is there, ladies are protected from so many things. Once
Yes.
that protection or the shield goes away,
Right.
then they are prone for many other problems.
Okay.
So again, malignancies and all. Then aging itself causes problems, atherosclerosis. Then the arteries become stiff. The proper blood supply does not happen, and all these can.
So,
and hormonal changes, of course.
Yes.
That can cause
So
problems.
diabetes, basically in diabetes, all this hormonal production go down, right?
Yes.
Yeah.
Yes.
Do they get early menopause?
Yes, they can get early
They can
menopause
get early
if the sugars
menopause.
are not kept under control.
Not kept under
If the
control.
sugars are properly managed, they are like normal people.
Okay.
Only it
Okay.
all happens more often, and it's very obvious when the sugars are not properly under control. So
Okay.
you get all these complications.
All these
faster,
complications.
yeah.
Okay.
So it's oxidative stress, chronic inflammation, hormonal changes, which can happen at any time, and
Yeah.
especially with these coexisting problems, you get more of problems.
Yeah. Tell me one thing. Since we are on this subject of hormones, I'm little. I am curious about to know about people who are hypothyroid. So is it difficult to control these people who have hypothyroid and diabetes also?
Yes, actually, thyroid is also a hormone,
Right.
which is affected by many other external factors also, like emotions also, emotional
Right.
factors, stress.
Stress,
also
yes.
causes these hormonal fluctuations. In that case, it becomes difficult. then.
Okay.
So similarly with sugar, if the
Okay.
person is under stress, then sugars goes haywire.
Okay.
So also with thyroid.
Okay.
So there are hormonal changes happening because of hypothyroidism can make things difficult for them when the thyroid function is not kept under control. So that is one.
Oh, that is a real problem.
It's also a real problem.
Real
yeah.
problem. Yeah. Now tell me, if I ask you the little bit of figures, how do you define hypoglycemia? At what level the sugar falls, or what is hypoglycemia?
So when the blood sugar level goes to less than 70,
Okay.
it is called as hypoglycemia.
Okay.
That is level 1 hypoglycemia.
Right.
If the sugar falls little more, that is about 54, it
Okay.
is level 2 hypoglycemia.
Okay.
And the last level is when it falls to more than this, less than 40.
Okay.
And it is that state of hypoglycemia where the person is not able to take care of himself. He gets physically and mentally affected
Okay.
and needs somebody's help to come out of it. And if not tackled quickly, it can affect your brain.
Okay.
It can also cause permanent damage to the brain, irreversible hypoglycemia.
right.
Because within 3 minutes, our brain gets affected.
Right.
So it is 70, 54, and the last one
Okay.
is where a person needs help from
So in
others.
level 3, when the sugars go down below 40, person can become comatose?
Comatose, yeah, brain can
Comatose.
get affected, yes.
Yeah.
So
Okay.
we have to be quick in that
Right.
patients, So if the person
Right.
is not able to eat anything, start with a drip or give glucagon
Right.
injection.
Yeah.
And if a person is already diabetic, they should carry hypo tabs, that is glucose tabs, with them.
Okay.
If at the earliest of sign or symptom, if they understand something different happening,
Right.
they can immediately pop in a tablet of hypotab at least, or some
Okay.
glucose powder
Okay.
or something. And,
Do these
keep
people, apart
monitoring.
from unconsciousness, do they also get convulsions?
Yes, seizures can happen because
Seizures
of low
can
sugar,
happen because of
hypoglycemic
Yeah,
seizures.
okay,
It can happen.
okay.
It's all very well documented.
They are well
Yeah,
documented.
they can initially become, like initially it starts with irritability,
Hmm.
then they become restless, they may have tremors, they may start sweating, they have palpitations, and then it progresses to you can get seizures, you can even become unconscious because of
Right,
that.
right.
Yeah,
So all
comatose.
these people who are diabetic, you have to tell them all these possibilities.
Yes, we have to explain them,
Yeah.
we have to educate them.
Educate
Because
them.
hypos are more dangerous
Yes.
than once in a while sugar being little on the higher side.
Okay.
So we have to educate them, we have to ask them to monitor themselves, you have to ask them to eat on time,
Okay.
not to over physical activity.
Right.
Otherwise, again, eat something in case if you're over exercising.
Right.
And
Right.
then keep checking the sugars,
Yeah.
and always to carry something with them.
Right.
That's very important.
Very
Carry
important.
some healthy snack, even carry a hypo tab
Okay.
or glucose tab or glucose powder.
Yeah.
And in the hospital or
Yeah.
someone can give them injection glucagon when they are not able to eat anything by themselves, or if
Okay.
they have lost consciousness.
Right.
So either IV drip or glucagon.
Okay. Okay.
To reverse.
Now you told me about fasting blood sugar. You told me about postprandial blood sugar. What is random blood sugar?
Any time of day or night when you take a
Okay.
sugar,
Okay.
irrespective of your meal status, that is
Okay.
called as a random
Random
sugar.
sugar.
Yeah.
So people who are diabetic, you tell them to check for the random blood sugar. So, I mean, obviously there must be some apparatus with which we can check the blood sugar at any time of the day.
Yeah.
So, is there a particular level you tell them that your random blood sugar should be around 130, 140, 160 in people who are diabetic?
Yeah. See, those who are diabetics, we always ask them to carry a glucometer. It's such a small piece of
Okay.
It is easy, very portable to carry, and within a minute you come to know how much your sugar is
Right.
just by one single prick and putting on the strip. So we actually, if you are doing it for your management purpose to adjust medication or to know your status, then we ask them proper fasting and postprandial. Random sugar we ask them to do in case if they have any symptoms, like they are feeling giddy, they are getting
Oh, I
headaches.
see. Okay,
Yeah.
okay.
If they feel they're not doing good, they're not
Okay.
keeping well, in that case then we ask them to check random sugar.
So they should carry that
They
thing
should-
along with them.
Yes, they should always carry it with
Okay.
them. Such a small piece.
Yeah. What is called as diastics?
Glucometer.
Glucometer.
Yeah, glucometer. We have
Glucometer.
the strips. So you have to
Right.
just take a finger, give a one
Yes.
single bold prick,
Yes.
just press once, a drop of blood should come, put it on the strip, and
Right.
immediately you get
Immediately
the
get the
reading.
results.
Yeah.
Okay.
So it also depends on how you take. It has to be one single bold prick. If you keep pricking, if you keep squeezing, and if you do not put to test immediately, sugar
Oh.
values will change. So
I
it has to
see.
be done properly also.
Oh, even that
Yeah,
matters.
that also matters.
Okay.
That is the reason we ask them to check intermittently by lab also. But
Oh.
for emergency, you do not get lab reports immediately.
Right.
But otherwise, then because that's a venous blood, it's a
Okay.
capillary blood. So many things they matter when you
Right.
check the sugars.
Right.
So intermittently, we ask them to check by lab. But otherwise, in case of emergency, best is to check by glucometer.
Yeah.
That is called a self-monitoring of blood
Self-monitoring
sugar.
of the blood
Yeah,
sugar.
yeah.
Now, I don't know. Now, since we are on this glucometer test, are there any apps or something available in the market that which can, check your blood sugar just transcutaneously?
Yes.
I mean, I don't know, prick myself.
Yeah.
I mean, I just put it
Yeah,
like a
yeah.
watch or something.
Yeah.
Is available?
Already available.
Already available.
Yeah, yeah. We have this CGMS, that is continuous glucose monitoring system,
Okay.
where a sensor is placed beneath the skin once, and that keeps on recording the sugar for 14 days. So
Okay.
once you place it for 14 days, your sugars will get recorded.
Okay.
But we have wearable devices also.
Okay.
It is non-prick. They
I
have
see.
sensors, yeah.
Okay.
So thermal sensors, electromagnetic sensors. We even have this face meters by videos. Yeah,
Okay.
they scan it through your face. So wearable devices are there, smart watches are there.
Are
And
they
the
available in our
CGMS
country?
Yeah, the wearable devices have now been, you can get it from abroad.
Okay.
But CGMS, so we are doing for long time actually.
Long time. Okay.
Yes. Yeah.
In which patient do you advise this CGMS?
CGMS we advise for those who are on insulin,
Okay.
those who have very like labile sugars are very fluctuating, not under control.
Okay.
Yeah, elderly or those who are elderly people, those who have comorbidities like kidney problems,
Right.
where they are more prone to go into hypoglycemias because
Oh.
of renal issues.
Right.
So
Right.
those people who require frequent checking, then in those patients, CGMS is better.
Okay.
It automatically it will check the glucose from the interstitial fluid with the help of sensor. It will display it, and then we have the glucose, the insulin pumps also,
Right.
which can be connected for those who are on insulin. It will
Okay.
sense and it will release insulin
Oh, I see.
depending on the
Okay.
reading, how much
Okay.
it is like. Yeah.
Is it very expensive?
Not very expensive actually, but then maintenance it comes with a cost, of course.
With the cost.
Anything is
Yeah.
of this caliber will be little expensive, and the maintenance cost
Yeah, yeah.
around 50,000 per year or something.
50,000 per year.
Maintenance.
Yeah, maintenance
Yes,
cost.
yes.
And how much does it cost if you want to buy that?
Now it has become little less.
Okay.
Initially it was little expensive.
Okay.
But it will go to one.
But it is easily available.
Available. It is easily
There's no
available.
problem regarding
No
that.
problem regarding availability.
I think with this kind of apps that you have now at hand, I think the management of diabetes become a little easier for you.
Easier, yes.
Yeah?
Only
Easier.
thing is patient should afford that.
Patients should afford that.
Otherwise, repeated pricks, many people have phobia of the pricks. Then they get frustrated when you ask them to.
Okay.
Sometimes we have to advise them to keep on checking the sugars, maybe up to 7 times, 8 times in a day.
Oh,
So in that
oh.
case, then they have that phobia, they get frustrated, they don't want to keep pricking.
Keep pricking.
They do it initially and then they
Yeah.
stop doing.
Mhm.
So in that case, in such people, this is very good.
Yeah.
Only thing is they should afford it. That's
Yeah, yeah.
what.
This type 1 diabetic, when they are very young at their age, I mean, there also, I suppose, managing blood sugars must be very difficult.
Very difficult.
Very difficult.
Yeah.
Right?
Young children, it's difficult. They don't understand things that much. So it's really difficult. Somebody has to be after them, keep monitoring them,
Right.
check their diet, check their activity,
Correct.
check if they're taking the medications properly.
Yeah.
It's really difficult.
It's really difficult.
It's fluctuating. Yeah.
Now, you said that brain uses only glucose for survival or for normal functioning, you said. Now, if I'm not a diabetic, yeah, how frequently should I eat to maintain my glucose at optimum level?
So normally what we say is the stomach emptying time, gastric emptying time is 4 hours.
Okay.
So ideally also, even if you are not a diabetic, you should have small meals frequently to keep your metabolism going properly. So every 4 hours. Otherwise, at least breakfast has to be the best meal of the day.
Okay.
Like as that famous proverb goes, eat like a king. That
Okay.
is the breakfast. You eat your
Okay.
breakfast like a king, lunch like a prince, and dinner like a pauper.
Oh,
Yeah.
that's nice.
Yeah. So you have to, if you are following that, then good. Because anyways, after dinner, we hardly do any physical activity. We just
Right.
go to bed. So dinner
Right.
has to be the lightest, and breakfast has to be the best.
Best.
And
Okay.
if these 3 meals, and in between you can have some small snack, which is a healthy snack.
Okay.
In
Okay.
between.
Okay.
That is how,
Yeah.
yeah.
Like you said, in pediatric age group, or people with the kidney disease or people who have thyroid problems,
Yeah.
it's difficult to manage diabetes. Do you have the same experience in people who are alcoholics?
Yes, of course. Alcoholics also, no, it's both ways. Binging alcohol is not good. It can cause hypoglycemias, it can cause hyperglycemias, both
Okay.
ways. Because when you're binging too much of alcohol, and if you don't eat, then you may go into hypo also.
Right.
But otherwise, normally with alcohol, you take lots of snacks, which are usually fried snacks, so they're rich in calories, and your
Okay.
sugars can go up.
They can spike up.
Yeah, they can spike up.
Okay.
So both ways it is not good. Binging on alcohol is not good. You have to have alcohol in moderation.
Moderation.
What is allowed, like.
Yeah.
It's not good otherwise.
It's not
Yeah.
good otherwise.
Yeah.
One thing I have noticed, despite being a diabetic, I don't know whether this is your experience, despite being diabetic, we keep telling them to maintain the blood sugar. But I have seen people who are diabetic hogging more food. Is that also your experience?
When the sugars are not under control, if the sugars goes high, then they feel more hungry. There are three
I see.
cardinal symptoms of diabetes:
Okay.
polyuria, polyphagia, and polydipsia.
Okay.
So when the sugar levels are high, you feel more thirsty,
Okay.
you have more appetite, you feel like eating more, and you go more often for urination, and especially at night time more than 3 times. It's called as nocturia. So it's because of your high blood sugar level you feel more hungry.
Okay.
And in spite of eating more, you lose weight and you feel fatigued and weak.
Okay.
Actually, so
Okay.
hogging maybe because the sugars are not under control.
Oh.
But even in hypoglycemia, you feel hungry
Yes.
when the sugar levels goes low.
That I can understand.
Yeah.
That I can understand.
But high sugars also, this is one of the
Yeah.
cardinal signs. No?
Because this has always confused me a lot in the beginning of this podcast, that body has this negative feedback mechanism.
Yes, true.
If my sugar falls, obviously body needs sugar.
Yes. True.
So if I don't take sugar, body probably might mobilize the sugar from liver, from the
Yes.
glycogen.
Yes. Correct.
But in hyperglycemia, I mean, there is no thermostat which is working. I mean, I still want to eat more and more.
Yeah, you feel like eating more and more
Yeah.
because of polyphagia. But that is the reason you should check.
Okay.
If something is happening, unless you check, you will not come to know where you are.
Okay.
Whether you are in hypo or hyper.
Oh, okay.
And accordingly, you have to then adjust.
Oh, it can be symptom of both hypo and
both.
hyperglycemia.
It can be a symptom of hypo
Yeah.
as well as hyper.
Yeah.
And then you have to check and you have to adjust accordingly.
And despite hogging repeatedly, they still keep losing weight. Right? They don't
yeah,
put on weight.
in spite of eating more, they lose weight.
Oh, I see.
Because the metabolism is such, no?
Okay.
Yeah.
All right.
Catabolism is more.
Okay.
That is,
Okay.
yeah.
Now, one thing that what is CKM syndrome?
Yeah. So it is cardiovascular-kidney-metabolic syndrome.
Okay.
So actually, the CKM syndrome terminology has recently been coined in 2023 by American Heart Association.
Okay.
But if you see, we had been managing these patients for years.
Right.
But we had been managing them individually, independently.
Okay.
We had been managing diabetes, we had been managing hypertension,
Right.
we had been managing dyslipidemias
Yes.
and stroke, all these things.
Okay.
But then when it comes under a banner, why this was done, why they had come out with this terminologies, they had found that all these problems are interrelated etiopathogenically.
Okay.
They share the same causative factors and mechanisms and presentations and management, and all these diseases, whether separately, also cause that much of mortality, morbidity. So that is why they have, and they are interlinked. That
Okay.
is why they have brought them together, because they were seeing that the incidence of these problems are increasing and more young people were getting affected. So that is why they have come up with this terminology,
Okay.
which is cardiovascular-kidney-metabolic syndrome.
Okay.
And they have put into different stages.
Okay.
So we have to start from the stage so that it becomes easy to manage them. That is, like, if you want, I can tell you the stages.
Yes, please.
So it starts from stage 0.
Mm-hmm.
Now in stage 0, actually, it is a completely normal person where the sugars are normal, blood pressure is normal, cholesterol is normal, patient's weight is also normal.
Okay.
So then you may ask me, then why is this person included in stage 0 here?
Right.
It is for the purpose of screening.
Okay.
Because if you screen them early
Mm-hmm.
and if you detect problems early, it becomes easier to treat such patients.
Okay.
And we can prevent them from landing into complications.
Okay.
We can prevent complications like, for example, kidney patients, if they're not treated properly,
Right.
or if they progress, then they will go on dialysis, they may
Yes.
require kidney
Yes.
transplant. And so also, like, if the blood pressure, sugars are not properly managed, then they will land up in various complications
Right,
related
right.
to eyes, heart, brain,
Right,
kidneys,
right.
whatever. So that is stage 0.
So, so-called normal people, they come in stage 0.
Zero.
So-called normal people.
So-called normal people where
Yeah.
everything is normal,
Right.
but still they are included,
Right.
so that we screen them from time to time.
So, all of you screen all of them, or you select few of the guys for the
We can include
screen.
everyone in this actually.
everyone.
But at least elderly people more than 40 years
Okay.
who have family history of any comorbidities,
Fine.
then we can include them. no?
Okay.
Then comes stage 1.
Okay.
Now stage 1 is where there is excess dysfunctional adipose tissue.
Okay.
So excess dysfunctional adipose tissue means they are either overweight or obese.
Right.
So now with this overweight and obesity comes the metabolic syndrome. So
Right.
usually they have abdominal obesity, so because of which their blood pressure will be high,
Okay.
their triglycerides may be high,
Okay.
they may have impaired glucose tolerance because of insulin resistance.
Okay.
So here, if you advise them lifestyle modifications, that is change in diet, change in activity,
Right.
and if you advise them to lose weight,
Okay.
only 3 to 5% of weight loss also at this stage
Oh,
will
really?
give them lots
Okay.
of benefits.
Okay. Okay.
So that is how we have to screen and we have to manage.
Okay.
And if you do not treat them at this stage, or they come to you after this stage, that is stage 2.
Okay.
Now-
Before that, what is abdominal obesity?
So abdominal obesity is the abdominal girth, the
Okay.
waist circumference.
Okay.
Now for Westerners or other people, apart from Indians, because for Westerners it is the abdominal girth of more than 86 in ladies
Okay.
and more than 106 in males.
Okay.
But for Asians, we Indians, it is 80 and 90. 80 for ladies and 90 for males.
Right.
So if it is exceeding that, it is called
Okay.
as abdominal obesity.
Okay.
So what the problem we Indians have is the fat is accumulated more on the abdomen.
Okay.
If
Under
you
the
see
skin.
under the skin.
Okay.
If you go to see the Westerners, they may be having more weight than Indians.
Okay.
But then the fat is distributed uniformly
Okay.
all over.
Mhm.
It's not only in the abdomen, on the
Okay.
abdomen. In Indians, it is on the abdomen.
Okay.
So that is metabolic syndrome.
Why this difference?
That is the ethnicity actually.
Okay,
yeah.
fine, all right.
So because of that, we are prone for all these problems.
Okay.
We are prone for diabetes, hypertension, metabolic syndrome, hypertriglyceridemia.
Right. So the abdominal obesity is not same as visceral fat.
No,
That's
this
totally
it is
different.
It is different,
Okay.
but it is not good.
It is not
It can
good.
cause problems. It already
Okay.
causes problems.
Okay.
We are thin fat Indians.
Thin
Our
fat
weight may be
Indian.
less, but abdomen obesity is more. That is why we are called as thin fat Indians.
Right.
And that causes impaired glucose tolerance and hypertriglyceridemia and hypertension.
Right.
That's metabolic
Okay.
syndrome.
Okay.
Then we have now, that is stage 1.
Right.
And 3 to 5% of weight loss with lifestyle modification goes a long way.
Okay.
And then we have stage 2. Now stage 2 is where there is already these metabolic
Right.
factors are there.
Right.
The impaired glucose tolerance, triglyceride levels are high, and the BP, hypertension may be there. And on top of that, the CKD element comes in.
Okay.
That is
In
chronic
stage 2.
In stage 2.
Okay.
Yeah. It is chronic kidney disease.
Okay.
And then if you don't treat that, it progresses to stage 3.
Okay.
Now stage 3 is where there is subclinical ASCVD. That is
Okay.
atherosclerotic cardiovascular disease,
Right,
along with
right.
CKD, which is already there,
Okay.
along with
Okay.
abdominal obesity, which is already there. So you're overweight, you're obese with CKD, and now it is subclinical ASCVD.
Right.
And at this stage also, if you're not able to manage, they will progress to the other stage, that is
Okay.
stage 4.
Okay.
And that will be that is clinical ASCVD.
Okay.
So here they will have, they can come in heart failure, they may come in atrial fibrillation, they may come with
Okay.
stroke, they may come with peripheral arterial disease. So
Yeah.
here the brain also can get affected
Right.
at this
Right.
stage.
Right.
And they are already obese
Okay.
with
Okay.
other problems.
So as more and more organs get involved, your stage
Yeah.
also go on worsening,
Worsening,
right? Yeah.
yes.
So you are saying that stage 0, basically we are looking at normal people who don't have
Yes.
any overt signs or symptoms of the
Yes.
disease.
Correct.
And stage 5, you are saying almost multiple
Full-blown,
organ
yeah,
involvement
full-blown,
in here.
yeah.
So you are trying to tell me that we have to be careful at stage 0.
Yes.
Try to find out the risk
Yes,
factors
yes.
which can progress further to stage 1 and stage
Yes.
2. And if you find a risk factor, try to raise some red flags on
Yes,
those people
at that time
at that
itself.
time itself,
Yes.
and keep monitoring
Keep
them at the
monitoring.
usual interval.
Yes.
That is what the
Yeah,
message.
that is what the motto of bringing all this in.
Okay,
Actually.
giving such valuable information about diabetes. It's a very, very complex subject, diabetes per se, and there is so much variability in the patients, it's not an easy job to manage these people. You know, it is not easy job. Now, since we are gathered here today to discuss on brain stroke and risk factor for the brain stroke, another disease which comes to mind is a hypertension. You know, I find hypertension is, if not more, but it is equally lethal kind of disease to have, as far as all the organs are concerned. Yeah. But since we are promoting here on the brain stroke, let's try to restrict hypertension as far as the brain is concerned. And I call hypertension as a killer disease, you know, because in our practice, where people come with the brain hemorrhage, almost 60 to 70% people have got hypertension. In fact, there was a time about a month ago, about 5 patients were admitted in the ICU with the brain hemorrhage, and the youngest one was 23-year-old girl, and the oldest was about 34-year-old male, and all 5 had hypertension, and which was detected after admission. So what I'm saying, brain hemorrhage can be a first symptom of hypertension. And my specialty is basically about surgery for the brain stroke, and we started doing surgery in 1990 when I was in KM hospital. And we have had a very large series of personal series of brain stroke surgery. The trend has changed. Up to 2000, whenever there is a brain hemorrhage, it was because of aneurysms and AV malformations, you know. We never used to see so much hypertensive hemorrhages. After 2000, the whole scenario, the pattern has changed. After 2000, what I'm saying, more and more of patients coming to us with hypertensive hemorrhages, and we are not seeing aneurysm AVMs so much. Not that they have reduced in incidence, but they are going to the intervention radiologist.
True.
So they are not coming for surgery. But there is no question, unquestionably, the incidence of hypertension hemorrhage has gone up. You know, and still about till 2010, if somebody gets a brain hemorrhage, we should say that that person may be 60 plus or something. You know, it has not remained a disease of old anymore. You know, it has become commoner in younger people. You know, so so let's discuss some basics about blood pressure. You know, what is a normal blood pressure? I mean, if some patient has a hypertension and he's on medication for blood pressure, what figure do you target for?
Yeah, so the best figure I can see is 130/80.
All right.
The best figure.
Okay.
If you are a diabetic, especially, if it is 120/80, still better.
Oh, I see.
Yeah, if you are elderly,
Okay.
we may take up to 140/80.
I see.
But
Okay.
persistently, if it is 140/90, it is still taken as hypertension.
Right.
And we need to adjust medications.
Okay. Okay.
Yeah. So
What is
130/80 to 140/80, I will
Yeah, in
take it as
elderly
an
people.
elderly.
But you should ideally target for 130/80.
130/80 is the best.
Yeah, and in
Yes.
diabetic, 120/80 is
Lesser
still
than
better.
that. Yeah, still better.
Still better.
Yes.
Now, there is something of the diastolic hypertension.
Yes.
You know, this figure which is below the line goes up.
Correct.
What is the meaning of that?
Yeah, so we have even isolated systolic hypertension. So also we have diastolic hypertension.
Right.
Now diastolic hypertension is where the systolic blood pressure, the upper one is normal,
Okay.
but the diastolic blood pressure is on the higher side.
Okay.
It is isolated diastolic blood pressure which
Okay.
is high.
Okay.
It's called as diastolic hypertension.
That is above 90 or above
90,
80?
above 90.
Above 90.
Above 90, yes.
Okay.
90 and
Okay.
above we take.
What it basically suggests? Why does diastolic hypertension
Because
happen?
both are not actually, even systolic blood pressure going high is also not good.
Okay.
But diastolic blood pressure going high is actually not good. It causes more of the perfusion problems, tissue perfusion gets affected,
right,
and
right.
damage to the other organs can
Okay.
happen.
So
that
target
is a-
organ failure is higher
target
with the
organ failure
systolic
is
hypertension.
higher with diastolic hypertension
Okay.
and very high systolic blood pressure.
Okay.
Not
Okay.
with little higher systolic blood pressure.
All right.
So
all
even
right.
if the systolic BP is too
Yeah.
high, can affect
Yeah.
target.
And both
organs.
needs
Both
treatment.
ways, yeah.
There is
Both
no
needs-
question about
yeah,
that.
very high systolic
Okay.
blood pressure also needs treatment.
Okay.
Diastolic, of course, needs
All right.
treatment.
Now, when a person gets blood pressure, you know, which is the first target organ which suffers in case of hypertension?
It is the kidneys. we
Kidney.
can say.
Always the first?
Not always.
But
Sometimes,
commonly
as
kidney.
you've said, that patient comes with bleeds.
Right.
We're seeing more of hypertensive bleeds these days.
Right.
It's because of sudden shoot up of the blood pressure
Right.
when you get hypertensive
Right.
bleed. That can be the first presentation.
Right.
Sometimes,
Right.
and it is happening more often these days.
More often these
but
days.
kidneys, yes, it is because the vasculature of the kidney gets affected, and
Okay.
especially if there is renal artery stenosis, if you
Right.
say,
Right.
which is not detected. That can also
Okay.
be the reason for hypertension.
Right.
That is the secondary cause of hypertension.
Okay.
Though 95% of times it's the primary cause
Primary.
where no cause is actually
Right.
found, and you have
Yeah.
to treat accordingly.
Yeah, yeah.
So kidneys gets affected, the perfusion gets affected,
Right.
and sometimes brain strokes
Yeah.
can be the presentation. Cardiac problems
Right.
can happen.
So if I consider three organs, it's like brain, heart, and the kidney.
Kidneys, yes.
Hypertension tends to affect which organ more?
It varies.
It
varies,
varies.
you can say. But
Yes.
kidneys are supposed to get affected both by hypertension and by diabetes,
diabetes.
earliest. Yeah.
Okay.
But it can be heart and
It can be
less
heart.
commonly the brain
Yeah.
comparatively.
But
yeah.
it does affect all the
all
organs.
the organs of the
Diagnosed as hypertension, you know, can I don't want to take medicines, you know, but if you tell me you can control your blood pressure with just a diet, exercise, you know, or maybe yoga or meditation, is it possible?
It depends on what stage of hypertension you present actually. If you are not, you have not come with very high blood pressure, it is still possible to manage with lifestyle modification.
Okay.
So you have to follow a proper diet where we follow salt restriction. Now, if a person who is not hypertensive is allowed to consume up to 2 grams of salt in a day.
Grams.
If you are not a hypertensive,
Right.
if your blood pressure is normal, but if you are a hypertensive, you have to cut down your salt intake to 3 grams.
All right.
So then we advise our patients and their families to not add extra salt or to minimize the salt when you add in the while cooking the food. So not more than 3 grams in a day. Don't add table salt.
Okay.
Don't have pickles, chutneys, papers,
Okay.
where we add extra salt as a preservative. So naturally the salt consumption goes up.
Okay.
Even Chinese food where soya sauce is added, it's
Right.
a main ingredient of Chinese food, which is it has very high salt content.
Oh.
So
oh.
that also we advise them to refrain from.
Okay.
So extra salt has to be avoided, and not more than 3 grams of salt in a
Okay.
day is to
Yeah,
be
yeah,
consumed.
yeah,
That is
yeah.
one. Second is physical activity. We ask them to do some regular physical activity every day. Maybe a 30-minute walk every day if it is
Okay.
moderate intensity. If it is high intensity, it can be 75 minutes in a week also could be sufficient. But that has to be a sustained physical activity.
Okay.
Doing one day, not doing 4 days is
Right.
not going to help you. It can be more
Okay.
deleterious for you.
So
it has to
perseverance
be-
is important then.
Yes, yeah.
Okay.
Sustained physical activity, proper diet, weight
Right.
reduction. If you're overweight, obese, then you have to concentrate. If you are able to reduce your weight, if you're able to do proper activity every day and control the diet, it may help for reducing the blood pressure. It's a documented thing. You know, restricting salt will reduce your blood pressure by 5 to 7 millimeters of
Okay.
mercury systolic. Activity again 5 to 6 millimeter.
Right.
Reduction of weight can reduce it by 10 to 15 millimeters also.
Okay.
So
Okay.
if your BP is
Okay.
not too high, lifestyle
Okay.
modification can
Yeah.
help.
Yeah,
And
yeah.
then you stick to that
Right.
and keep monitoring.
Right.
If it is too high, then you will require medications.
Yeah. You used word table salt,
Yes.
right? And you advise to avoid table salt.
Extra.
So
excess,
extra.
yeah.
So if not table salt, which other salt you will prefer them to have?
No, but then see, because it is the sodium
Understand,
which causes
yeah.
the BP. Now there are salts which has only potassium. Iodized salts
Iodized
are
salt.
with potassium,
Right.
not with
Right.
sodium.
Yeah.
Then we have this puro salt, the pink
Yeah.
Himalayan salt, which has less
Yeah.
of salt.
Okay.
Then we have the Tata low salt, where
Yeah.
less of sodium content
So you
is
tell
there.
them like this, you
So
can
we
you
can ask
take.
them to go for
Okay.
those substitutes instead of this, but still monitor. The total
Still
sodium
monitor.
intake should not be more than 3 grams in a day.
Now, when you tell me you can have about 5 grams of salt or 10 grams of salt, so how do I measure? I mean, 1 tablespoon is, I mean, roughly.
Approximately. Yeah.
Yeah, yeah.
It cannot be, we always don't measure, but it's an
Exactly,
approximate.
approximately.
Yeah, that's what,
Okay.
yeah.
Because, you know, you get those small sachet for
Yes,
sugar, 5
yes,
gram sugar,
yes.
things like that.
Yeah.
So I forgot to ask you in the previous section, since now we are on this dosage of salt
Yeah.
or sugar, uh, for a normal person who is not a diabetic, yeah, how much sugar or salt should be allowed to have?
Yeah, so for a female, they say sugar up to six spoons in a day.
6 spoons. Okay.
Teaspoons.
Okay.
And for a male, it is up to 9 teaspoons in a day.
Okay.
Because
Okay.
according, I don't know who has made that, but according to them, the male does more of physical activity
Okay.
compared to female. So
Okay.
that is why they are allowed to consume little more, maybe.
Okay. Okay.
So that is what I have read, that 6 teaspoons for a lady and
Okay.
9 teaspoons for a male
Okay.
for sugar consumption.
For sugar consumption.
Yeah.
Those are not diabetic.
Yeah.
And what is the salt restriction for this?
10 grams for normal people.
So 10
and
grams.
hypertensive 3 grams.
3 grams.
Yes.
Oh, that's it.
Yes.
Okay.
Yes.
Now, when we started, we were saying that hypertension is not a disease of the old anymore. Are you seeing this hypertension more in younger people?
Younger and younger people. It's
How
on
young?
the rise.
Yeah, on the rise.
Yes.
How young
We are
guys
getting
must have seen?
in 20s also we are
In
getting.
20s?
Yeah. Maybe because the lifestyles have changed. They are more into, one is the fast food thing.
Okay.
Influenced by Western fast food they are into. Many of the parents, they complain that the child does not eat at home. And even if they eat at home, they order. And what they order is pizzas, burgers, fast food, so which is very salty, and processed foods, like even this fries, which is there, the
Right.
potato fries and all.
Right.
Now consuming one moderate packet of,
Okay.
that is equivalent to smoking 25 cigarettes. That's what they say.
Really?
Yeah.
This is shocking.
Yeah, that's what. So that is, and then secondly, the sedentary lifestyle. No, they're not into physical activity. They're always on their gadgets, playing on their gadgets, not going out to play. So no physical activity. So then sitting is also new smoking. So that is also there. That is also
Let
there.
me tell you one thing: the youngsters, they are on Google so
Yes.
much. They try to find
Yes.
out everything on Google.
Yes.
Don't they see all these things?
They may not be seeing this. They may be
The
just
selectively-
selective. Yeah, that's what.
Yeah.
So what is actually required is not done. They are into something else, on the gadgets, sitting continuously, more into fast foods, no physical activity, and lot of stress and pollution these
And
days.
pollution.
That also adds. That
So,
also,
like say obesity, hypertension,
Yeah.
diabetes,
Yes.
everything is coming out early
early
stage,
these
right?
days, everything is coming early. Now even for diabetes, when we go, because we want to detect people in the pre-diabetic stage,
Right.
so that we can prevent them from progressing to diabetics
Right.
and prevent complications,
Right.
morbidity, mortality. So what I do is, I tell my staff to go and screen in the schools.
Okay.
Like when we have started with this diabetic foot clinic, I asked the sisters to go in the school. So many children get detected with pre-diabetes. They are not symptomatic.
At
They
what
had
stage
never
you start
checked.
screening for them for the
In the
diabetes?
school itself
In
nowadays.
the school.
Yes.
At which standard?
You can check from 8th, 9th standard.
Okay.
At 13, 12 years, 13 years, they are getting detected with pre-diabetes.
Oh.
So especially if you are having a family history of diabetes, if you are chubby, obese, if you are not into too much of physical activity, if you are used to eating such kind of foods, we should screen them more often, and we can detect them, and accordingly then we can teach them, guide them, advise
Okay.
them, whatever, so that at least they get controlled at this stage and they do not
Okay.
progress further. So likewise, even for hypertension, we are getting, maybe because of these things, more into fast food, no physical activity, obesity. So hypertension is happening more and more in younger people, like diabetes. So the incidence is on the rise in younger people.
I read somewhere, I heard somewhere that India is just probably second to China in obesity in the world.
Correct.
And the second thing, in fact, the children who are born, many children are obese nowadays.
Yes.
You know, is that true?
It is true, and
It
it's
is
not
true.
good.
Yeah,
It's not
it is
good
not
too,
good.
yeah.
Because I heard one parent saying that my birth weight of my baby was 4.5 kg. So I thought that this is obese baby. This is not a
Yes,
normal
it
baby.
is. It is obese baby.
So don't they understand this?
And actually, I don't know. Many people think that chubby child is a healthy
Yeah,
child, which is
correct.
not the actually
Which is
it is
not
not
the
the
case.
fact. Yeah, it's not
it
the
is not the
case.
case.
Yeah, later on they will get so many
Right.
problems if at
Right.
birth their weight is so much. So that is not right. The parents should be counseled. We should start with actually premarital counseling, and even during pregnancy, the gynec and the obstetrician, they should actually keep on hammering the parents.
Right.
And proper lifestyle has to be inculcated right from birth.
Right.
And
Right.
that is it's very important.
Correct.
Because we are getting many people,
Yeah,
and earlier, like diabetes. Not only diabetes, India is the diabetic capital of the world, but India has highest number of hypertension patients, highest number of cardiac patients. Everything is more in India, which should not be actually.
Which not
We
be.
should not be the capital of our diseases. We should
Right.
be the care capital actually.
Correct, correct.
But which is not the case. It's
Do you
not
think
good.
it is somehow related to our skyrocketing economy to some extent?
That could be playing a role.
Yeah, because with this economy going up,
Yes,
everybody has
yes.
earning money.
Affordability now,
Affordability is
yeah.
going up. You are
Yeah.
buying luxuries.
Correct.
When you buy luxuries, you get something as a return gift.
Yes, true.
And this return gift probably is hypertension, diabetes,
Could be.
and
Could
obesity.
be. Yeah, because
Yeah.
as you rightly said,
Yeah.
it can be one of it. It
Yeah.
is, I can say.
Correct.
Yeah.
Because this was not the case or discussion used to happen in
Earlier.
last century.
Last century.
Earlier was something different.
Different. True.
Right? Now the
Things
things
have
have
changed.
changed and they're changing very
Yeah,
fast.
True, true.
Very fast.
Very true, yeah.
And one thing that, when I talk in a lecture, when I hear somebody in a lecture, as far as hypertension concerned, apart from rising incidence, there is a definite group which is divided into three groups. It is are you aware of that? 1/3 rule in hypertension.
hypertension,
What
yes.
is that? Can you just elaborate on
You
this?
see, it is actually, 1/3 of the people do not know that they have hypertension.
Right.
So that
One
is
thing is a very, very big population.
Big population.
Yes.
It is
Yeah.
directly 30%.
Right.
So they don't know that they have hypertension. 1/3 of them, even if they know, they do not go for treatment for hypertension.
Right.
And then 1/3 of them, even on treatment, are not under control.
Under
So
control.
it is, that's
I
what.
think that's the most dangerous group.
Yes, yes, true.
Because they think that they have hypertension, they are taken under treatment and they are
Yeah.
safe. I think that's the most dangerous group that we are
Dangerous group,
facing.
true, yeah.
No question. I think we were discussing about this CKM syndrome, before we started with hypertension.
Yes.
Yeah. The stage 5 that you spoke
Four,
of, where almost every organs are involved.
Yes, stage 4.
Stage, yeah. At what stage brain starts getting involved? Or brain is already involved but manifests later?
That is at stage 4.
Stage 4.
Yeah, because
Yeah.
it may be involved, but it is not visible.
It is
so
not
that
visible.
is the reason we should
Yeah.
start screening at the early
Early
and
stage.
prevent progression. To
Okay.
detect things early, we can manage things better,
Better.
and prevent coma. Otherwise, it's at stage 4 that the brain also gets
Okay.
involved.
Hmm,
Because already there is CKD, already there is ASCVD, and there is
Right.
clinical ASCVD.
Clinical
And
ASCVD.
if it's not under control, naturally brain
Yeah,
gets
yeah.
affected
Yeah.
at that stage.
Correct, correct.
And patient is already obese also.
Right. What is white collar hypertension? I heard.
Yeah, white collar hypertension or white coat hypertension
Yes, yes.
is when the patient goes to a clinic or to a doctor.
Okay.
That time the BP shoots up.
Okay.
That is called as white coat hypertension.
Okay. Hmm.
The BP may be normal when they are not in the office of a doctor.
Okay.
So when you monitor at home, BP will be normal.
Okay.
But when they go to the clinic, they go to the doctor, the BP shoots up. That's called as white coat hypertension.
Okay.
Maybe because of stress, anxiety,
Okay.
something like that.
Mhm.
But then that is why we have to, in such patients, what is advisable is to monitor more often out of the doctor's office.
Okay.
Somebody else can check the blood pressure. Maybe the automated BP instruments which are available.
Okay.
Or the best is to do ambulatory BP monitoring
Okay.
in such patients if it is too much of fluctuations.
Right. So this is called as, in short, ABPM.
ABPM, yes.
Why? Where do you advise them people to go for ABPM examination?
So it's ambulatory BP monitoring,
Okay.
where continuous monitoring of the blood pressure is done. We have
Okay.
to set the machine in such a way
Okay.
that it is either it checks your BP every 30 minutes or every 60 minutes.
Okay.
So throughout in 24 hours, maybe there are about 50 to 100 readings or 100 to 200 readings.
Okay.
Now, why this is important is, one, those who are hypertensive, but the blood pressure is not under control, and those who are anxious, those who are obese,
Okay.
and not following proper lifestyle. BP keeps fluctuating, maybe white coat hypertension, or maybe in some of them the BP is high at home, but when they are out is normal. Most of them have symptoms, getting headaches intermittently, sometimes they feel giddy, sometimes they have difficulty in breathing. In those patients also we need to monitor the blood pressure, and those who have comorbidities like diabetes, cardiac issues, in those people also we need to monitor. So in such patients it is better if the BP is fluctuating too much, and many a times night time also BP fluctuates. Ideally at night the BP should dip. Some of them are non-dippers.
Okay.
And those who are non-dippers, and when the BP increases early morning, that can also cause cardiac emergencies and strokes and other things. So in people where we want to monitor BP properly, continuously throughout, to know when exactly is the BP fluctuating, so that we know exactly when the reading is high, when it is low, so we can adjust the medications also properly. We have it documented, and accordingly we adjust. And then once they see, when they see with their own eyes, they know that the BP is really fluctuating. So they also start taking, and they follow your instructions. They take precautions. So it's once in a while, when it is too much fluctuations.
These hypertensive patients, do they have a tendency to spike in the night?
Actually, hypertensive patients may spike at night. They may be non-dippers.
Okay.
So then we have to adjust the night medicines for them. That is why also this is important. ABP.
Because many times I heard the stories that people telling me that I spoke to the guy last night. We had dinner together. We saw TV together. He was perfectly all right in the night.
Suddenly,
and when I went in the morning to wake him up, he was unconscious. So something happened in the night, right? So this may be one of the non-deepers where the BP shot up during that time.
That's true.
But that's a regular phenomena, I suppose. We see in people who are hypertensive.
In hypertensive, it may not dip.
It may not dip.
It should dip.
It should
so
dip.
if it's not dipping, then we adjust the
Adjust
medicine.
the dosage. And that is where the ABPM comes into
coming
handy.
to play,
Okay.
Because we cannot wake the patient up and check the BP. So it automatically gets recorded.
That was a very nice discussion about ABPM. As a physician, I'm sure you must be getting plenty of references to give fitness for surgery. Do you think that a few years ago, person used to have just one risk factor? Now, do you think that they are having multiple risk factors?
Exactly.
They are hypertensive, they are diabetic, they are obese, something of that kind.
Yes. Everything together.
Everything together.
So they are actually the CKM candidates.
Yeah, they are CKM candidates. So giving, so when you clear such patients, CKM patients for surgery, what extra precaution, what extra investigation do you ask for?
No, because whatever fitness is for, we have to take things seriously, because small surgery can also cause major issues. So we have to evaluate them thoroughly. So what I do is I check their sugars, which is must for any surgery. I check the lipids also, which is not a must for all surgeries. So I do lipid profile, I do kidney function, I check the sugars, I check the weight of the patient, which is already patient is mostly obese, and then the basic in ECG, 2D echo, sonography. These are the routine tests which we do.
Sonography do for?
See, sonography we do for many things. Okay, if the patient is obese, patient may be having fatty liver. So this MASH, MASLD, that's also one of the risk factors that also comes in CKM. And then if the patient is hypertensive and young patient, it could be secondary hypertension also. So we screen, we do color Doppler to see if there is renal artery stenosis. If that is there, and it's a correctable cause of hypertension. So we pick things on that in routine investigations. And then accordingly, then we start with antihypertensives if required. And we monitor the BP more closely. Accordingly, we give the fitness.
So I get your point. So in all that big basket of investigation that you ask for, I think everything is tested apart from the brain in such cases.
True,
so, I mean, as you said, if somebody in stage 0, where he's not symptomatic, overtly normal looking person, and then If it's not symptomatic, do you ask for a CT scan or MRI of the brain just to see
We don't normally
you,
ask for
unless
it.
it's symptomatic?
Yeah, unless symptomatic, or we get something on the physical examination
Right,
of the patient.
right.
Because one is the cost factor also.
Yeah,
Many
yeah.
people then do not actually agree for these
Yes,
investigations.
yeah.
But we monitor them.
You, as a the physician in the hospital, that you are getting patient for the surgical clearance with multiple disease.
Correct.
I am sure this is you are happening more frequently. You are seeing it more frequently. Um, Now, one that you told me that this is something which is very new to me, that number of obese children are increasing in the college and school levels. Number of hypertensive children are increasing in both school and college level. Where started screening should be started at the sixth or seventh standard onwards
Itself.
at the regular
True,
basis
true.
for both hypertension as well as for the
Diabetes,
diabetes.
yes, true.
Another thing which I never understood is that when you go to hospital for the health checkups, I mean all the organs are involved here. You check for the heart, you check for the kidney, you check for everything else.
Yeah.
But have you ever heard that people are doing some screening program for the brain, which is I think one of the most important organs.
Yes.
So have you heard that
No, that's
anywhere?
the saddest part of it.
That's the
actually.
saddest part.
All other single organ is included
Yeah.
except for the brain.
For the brain.
Which should have been included from
Yes,
the very beginning.
yes,
And
yes.
more so now, when we are getting more and more younger hypertensives, younger
Yes,
diabetics,
yes.
obesity.
Yes.
So this should be an integral part of our health
Correct.
checkup actually.
Correct.
Which is a sad thing. Now it should be included
It should
in
be
a regular
included.
health checkup.
So in Brainline that we have started these two things. One is that we have started screening people in the hospital as well as in the community to assess the brain risk for developing the brain stroke. That was started. We also have devised one special riskometer which will give us a score, and accordingly we can take the action. So things are happening. It's not that it's not happening. But till now, I mean, now that we are seeing such a rising incidence of brain stroke, particularly among the younger age group, I think we have to do this as a compulsory basis.
Correct.
Otherwise, it will go out of the hand very soon.
Yes.
Now,
Agree.
Can you throw some light on hypertension that you see more common in women? Mainly in different stages of life, say like in
Yes.
pregnancy or menopause or
Yes.
post-menopause.
Correct.
What could be the cause of this? Do you think the number is going up even in women?
Yeah, number is going up even in women.
Okay.
Because same thing, women are also working now.
Okay.
It's not that they're homebound.
Mhm.
So they have that stress of the office.
Mhm.
They are on the desk job. So they don't then can concentrate on physical activity. They also are into fast food. In the office they order for food which is a fast food, which is not good. So same thing, like in men, the incidence even in ladies is going up. And younger women are also falling prey for diabetes, hypertension.
Okay.
Obesity is also on the rise in Indian women. So same, like, and then suppose if it's a young lady, so same thing, hormonal changes may be because of PCOS, PCOD, and then when they're in the reproductive age, if they don't want to conceive, they're on OCPs. So that also contributes to hypertension as well. So PCOS, hormonal changes, then this obesity thing itself,
Right.
where all other hormones are dysregulated because of obesity, and then OCPs or drugs we can say, and then in the reproductive life is this, and at the time of menopause, as I've said, that estrogen that is withdrawn.
Right.
So the benefits which estrogen had been offering to ladies goes away. So they are equally prone, like men, for all these problems, hypertension, diabetes, strokes, everything. Then as long as estrogen is there, they are protected, the incidence is less. Once they become menopausal, then they get the incidence is equal to men, maybe even more than that. And then in the elderly ladies, because of stress, because of aging, because of the stiff arteries, they also get hypertension because of the stiffness of the
Right.
vascular, the resistance reduces, and the BP shoots up.
True, true. What kind of problems you see in women who are hypertensive when they get pregnant?
Yeah, so pregnancy-induced hypertension.
Right.
Then that goes into pre-eclampsia, eclampsia,
Yeah.
and all complications of
What is
pregnancy and
eclampsia?
labor. So eclampsia is when the BP shoots up, patient started passing starts passing proteins in the urine.
Oh,
So,
oh.
and then it becomes, then they, when it progresses further, then they can even get seizures.
Oh, I
And
see.
it is at that time, if possible, we have to induce the liver.
Oh,
Otherwise, then BP can cause deleterious effects on the body.
all right.
So BP shoots up, there's albumin in urine, and patient can get seizures. And
So,
other
chance of
complications.
miscarriages, abortions are
Miscarriages
high?
are there even in pre-eclampsia, and eclampsia we have to actually induce.
Okay,
That is
okay.
the treatment for
Terminate
that.
the pregnancy.
Terminate the pregnancy.
Okay,
Yes,
okay.
induce the liver.
But abortions are also very common in
Very
such
common
people.
in pregnancy
Yeah,
with
in pregnancy,
hypertension.
hypertension.
Yes.
Yeah.
Yes.
What role does genetic play in hypertension? I mean, if you have family history, it is necessary that we will have hypertension in future.
Not necessary, but genetics plays an important role. You know, genetics, especially when there are genetic mutations, genetic variations. You know, then you are prone for all these problems. You know, genetic is one thing which can cause both hypertension and diabetes to you.
Okay.
So the genetic variations, mutations, especially with certain genes, like you can take PCSK9,
Okay.
then APOB,
Yes.
LDRL,
Yes.
all these. Then you are prone for hypertension as
Okay.
well as for diabetes. Then hormonal changes, which will cause insulin resistance.
Right.
That will also cause
Right.
increase in the blood pressure.
Okay.
That will cause increase in your LDL level.
Right.
LDL is what we target these days.
Right.
And if
Right.
LDL level goes up, if
Okay.
the sugars are detected,
Right.
most of the diabetics, most of the dyslipidemics are already
Okay.
hypertensive.
Okay.
All these things goes hand in hand. They
Right.
coexist.
Correct.
So this genetic definitely hereditary, because most of the heredity element is there both for diabetes and hypertension.
Okay. Okay.
So genetic, chronic inflammation, hormonal changes, and
Right.
oxidative stress.
Right.
Because even in oxidative stress, the DNA gets damaged,
Right.
and then
right.
you get
Okay.
hypertension and
Yeah.
diabetes.
Have you come across any recent publication quoting incidence of hypertension, diabetes in people who have family history? What percentage of people
Yeah.
also develop diabetes and
Yes,
hypertension
yes.
with a positive family history?
Correct. So it is up anywhere from 20 to 80% it can.
20 to 80%.
Yes, it can
That's
go to
very
about
high.
80% also.
Oh.
Diabetes up to 50% they say, and hypertension can be still more.
Oh, really?
Yes, that's what I have read it. I don't remember exactly
Yeah.
where, but that's what
That's
I
a very,
remember
very high
reading. It's very
percentage.
high percentage
Extremely.
for hypertension.
So at some
Yes.
stage in life, you will definitely become diabetic or
Diabetic
hypertensive
or
if you have family
Yes,
history.
if you have a family history, you are prone for it.
You are prone for it.
Yes.
It's a very, very high figure you said.
evidence, yeah.
Now, you have been all along talking about lifestyle modification to manage diabetes, hypertension, stroke. And you also said about it is very important to monitor your blood sugar, blood pressure at the school and college level.
Yes.
Yeah, and the follow-up of young individuals.
Yes.
Now, with that, I suppose most of the basic things we have covered as far as diabetes and hypertension are concerned. I don't know whether you have understood this, but you have provided me with a very vital and important information in the basics of diabetes and blood pressure. You know, people have been talking a lot about hypertension, diabetes, but the basics that you cleared, the doubts which were there in your mind, were cleared by you. I think that is what the first thing that you should know. If you know what is a normal blood sugar, if you know what is a normal blood pressure, then only you will go beyond that, you know.
True.
And the kind of ignorance that people have that diabetes can affect, it's just a variation in the blood sugar, it doesn't do anything else.
That's not
Or
the
blood
fact,
pressure is just
yeah.
a variation in blood pressure, nothing else. They are not aware that these are both are killer disease,
Yeah,
and
what all
they
they can cause.
either alone or in combination
Yes.
they are killer disease,
Very true.
and they affect the entire body together.
Yes,
You know, and so thank you so much, Farah. I mean, it was really a pleasure talking to you. You
Same
know,
here, actually.
and
I really enjoyed talking to you today.
and
I
I hope
it
that
is useful for the people.
yeah, I hope that this is just the beginning of this podcast, and next time I think we should be talking something little more in advance.
Sure.
So thank you
Anytime.
so much for joining us.
Thank you so
and
much for calling.
I'm sure all our viewers will be happy to have you on the set and this kind of conversation. And I'm sure there will be a lot of reviews about this particular podcast. because when they give us a review, that is what we thrive on.
True.
Though we come to know their requirements and stuff like that. So thank you once again.
Thank you.
And it was
Thank you.
really a pleasure having you here.
Same here,
Yeah,
actually.
thank you.